Good morning, everyone. I'm Julie Murat from the Gabriel Foundation, and along with our fabulous presenters and team, we are delighted to welcome you to Cardiovascular Health in Companion Parrots. We're so excited for this continuing series of webinars and thank everyone who's been involved in putting them together. Our panelists for taking away the information that we have, and our veterinarians for helping us all understand how our birds need us and what we need to prepare for them. I'm going to turn this meeting over to Jessica Boone, and she will take it from there. We hope you enjoy us, and remember to tell your friends. You can find us on the Gabriel Foundation's page on YouTube. Take care. Hi, Jess.
Hi, my name is Jessica. I'm the operations manager here at the Gabriel Foundation. So we are excited for everyone to be joining us, as Julie said, for our second medical webinar this month. Where our panelists are two incredible veterinarians, Dr. Brenna Fitzgerald with Colorado Exotic Animal Hospital and Dr. Stephanie Lamb with Arizona Exotic Animal Hospital. Just a couple quick housekeeping tips. We are recording this webinar, so if you need to hop off at any point or you want to review any of the topics, we will have this posted on YouTube and our website, and we'll also be sending out the link as a separate email. If you have any questions, please put them in the Q&A located at the bottom of the screen. And please just remember, these are not personalized questions that you are asking specifically about your bird. These are just general ones. And if you want any specific personalized medical advice, please reach out to your veterinarian directly. I'm going to pass this off to Dr. Brenna Fitzgerald and Dr. Lamb for both of you to introduce yourselves, and then we'll get started right after.
Great, thank you, Jessica. As many of you know, I'm a bird nerd. Both Stephanie and I, both Dr. Lamb and I are bird nerds, but I do birds exclusively, and I got my training with Dr. Brian Spear at the Medical Center for Birds in Northern California. And since August of 2022, I've been here at Colorado Exotic Animal Hospital in Denver, where all we do is exotic species, and all I do specifically is birds. Dr. Lamb?
Hi. So I am also a bird nerd. I do mostly birds, probably greater than 50% of what I see is birds, but I do also do other little exotics as well, rabbits, rodents, ferrets, reptiles, that sort of stuff too. I've been working at Arizona Exotic Animal Hospital for approaching 11 years at this point, where it's just fully exotics. I also volunteer with a local wildlife rehab group in Arizona called Liberty Wildlife, where I'm working with mostly raptors there, but also pigeons and doves and other just native wildlife, little passerines, corvids, stuff like that.
All right, well, Brenna, if you want to go ahead and take it away, you are all set.
Sure, so I'm going to go ahead and share my screen, and we're going to see if things work the way they need to. Let's see. All right, guys. So looking at, I'm going to get this PowerPoint presenting. There we go. Are you guys seeing that full screen title slide? Yeah, good, okay. Minus these, the first thing I'm going to teach you about cardiovascular disease is that there's a D in it. Okay, so you see in this title slide, it's misspelled cardiovascular. There should be a D in it. So that's the first lesson of the day. But what we're going to talk about today is cardiovascular disease in our companion parrots, because unfortunately it's a very common problem that we deal with, us parrot parents and also veterinarians too. So for those of you who tuned into the Life Stages webinar a couple of weeks ago, and Dr. Pilney and I presented, you've seen this slide before, and all I meant to point out here is that these are kind of the age ranges in which cardiovascular disease, and also this table lists tumors because cancers get more common when you get older, but the age ranges of these different groups of birds that we tend to see cardiovascular lesions appear, and in how many of them, because like we talked about in the last the Life Stages webinar, there's, I think, kind of a little bit of a misconception as to how long parrots across the board are expected to live and what their life expectancies are like. And many people tell me, oh, well, I thought that they would definitely live to 80 or even more. And of course, there's a lot of differences by species. But it's very uncommon for us to see birds getting that old, actually, at least is my experience in practice. And one of the reasons for that is the relatively high prevalence of cardiovascular disease. It's very, very common. And the most common types that we see in practice, or that I see in practice in companion parrots, is atherosclerosis, or hardening of the arteries, and also heart failure, most often congestive heart failure, which many folks have heard of because they've had a human loved one with congestive heart failure, which we call CHF for short. And those are the most common scenarios that I see, and variations on that theme, or problems that stem from it, or complications from it. But we're going to talk about prevalence and risk factors, and I'm going to be wanting to hear what Dr. Lamb sees in practice as well, and what's similar and what's different to what I've seen in practice. But we're going to talk about treatment approaches, and we're going to talk about some preventative considerations with a special presentation by Dr. Lamb about some of the research that's out there regarding what are some supplemental things in the diet, preventative type considerations. So toward the end of the presentation, I'm going to be turning things over to her, and she's going to give us a lot of excellent information on those topics. What you're seeing here in this X-ray is you're seeing this is the this kind of white line here. That's the descending aorta, and down here in the bottom part of it is extra bright along its edge, and that is an example of advanced atherosclerosis, or hardening of the arteries, where the thickened wall of the artery can actually become mineralized and become more apparent to our eye. Let's see. Dr. Lamb, aside from these two broad categories of atherosclerosis and heart failure, do you feel like that kind of encompasses most of what you see in practice with parrots?
Yeah, I guess the one thing I will add is that every once in a while I do see a ventricular septal defect patient as well. And I would say, interestingly, I don't know how, I don't know if this is real or if this is just something that I am seeing, but I feel like it's most common in military macaws. If I'm going to see it in somebody, it seems like it's the military macaws. I can think of 2 military macaws and 1 Millet Gold that had ventricular septal defects. So I just kind of wonder if maybe there's something genetic with them.
That's really interesting, because I have not run into that myself. I have in other species groups more. It's true that things like atherosclerosis and heart failure are more kind of like your old guy stuff, right? And since we see cardiovascular disease appearing as something that develops over the years, and appearing in older parrots, what you might consider chronic degenerative disease, that's where my brain tends to go right away. But you can have cardiovascular disease of various causes in younger birds, and that can include congenital abnormalities. So Dr. Lamb was referring to basically an abnormal hole in the heart, so to speak. You sometimes hear people describe that, oh, I had a hole in the heart when I was a baby, and they fixed it and stuff. But there are some reports in the literature of septal defects like that it seems like, at least in the literature, most commonly it's cockatoos that are reported. And I feel like when I've seen it, it's been cockatoos, but there's so little that we know. So it's really interesting to have that different perspective. Okay, so first we're going to talk about a little bit of anatomy and physiology. I'm going to try not to be too dry and boring with these aspects, but just so that everyone knows a little bit about the heart and the major arteries and things in birds, so that this will all make a little bit more sense. So this is an X-ray image of a large macaw. This is like the side view, or what we call the lateral view, and then this is the view where we're looking at them kind of from underneath them, with wings and legs spread so we can see everything. This is what we call the ventrodorsal view. But what you're seeing here is a number of things, but just want to let you know that, here's the keel or the sternum. Their head's off this way. We have their spine and their wings reflected up out of the way, and their legs put off here backwards. But the heart sits right here, kind of tucked into the sternum. And then these major arteries come off the base of the heart and kind of head off in their various destinations. The lungs sit up here, just above the heart and these major arteries, and these colored areas are showing you their air sac spaces. So birds are really different than mammals in that they have a system of air sacs, and those are basically clustered all around the heart and the other internal organs, and in a way you can consider them almost a little bit of bubble wrap padding, but those inflate as part of their breathing. And that's important because sometimes we see disease like infections in the air sacs that are around the heart here, including this blue air sac that's all around the heart, and also disease in the lungs, which, because it's so nearby, it can affect the heart and the arteries. So certain infections can cause cardiovascular problems. But that just gives you an idea of where these things are situated in the bird. Yeah, so birds have a four-chambered heart like us. I think, Stephanie, am I correct in that reptiles have three-chambered hearts?
Correct.
Right? Okay. Okay. And that's about where my understanding of reptile cardiology ends. But anyway, yeah, so but birds are a little more like us in that they have four chambers. They have on the left side the left atrium and the left ventricle, kind of in the schematic here. And the valve that's between those two chambers is most commonly called the mitral valve. This is true for us too, and our dogs and cats and things like that. The aorta, the major artery that comes right out of the left ventricle and then supplies most of the body, shoots out right here. And it is governed, or the blood flow out of that is governed by the aortic valve. So when the left ventricle, which is the largest pumping chamber, contracts, it pushes, and the aortic valve opens, it pushes blood out through the aorta and through most of the body. And then on the right side, we have the right ventricle. Its only job is to pump blood to the lungs specifically. And then we have the right atrium. You can kind of consider the atria here as almost a foyer on blood coming back and on its way to fill the ventricles and then get pumped forward again. So, but something that's kind of cool about birds is that their right ventricle is pretty different than ours. We'll show you some more pictures of that. And also, the valve that goes between the right atrium and the right ventricle is also quite different in them. In us and our dogs and our cats, it's called the tricuspid valve, and it's kind of a valve very much like the mitral valve, but in birds it's different because it is actually muscular. So it's like this muscular flap that contracts actively along with the rest of the heart when it beats. So it's kind of a really unique feature. This is what a dissection looks like in a hyacinth macaw. And so you have this big left ventricle, it fills with blood here, and it pumps blood out through the aortic valve into the aorta. When blood comes back to the left side of the heart to be pumped again, it comes into the left atrium, which then filters through the valve here into the left ventricle, and it's ready to be pumped to the rest of the body again. When Blood is pumped to the lungs by the left ventricle, or excuse me, by the right ventricle. It goes to the lung circulation, it gets reoxygenated, and it comes back to the left side. Blood coming back from the rest of the body, now the oxygen has been taken out of the blood and it comes back into the right atrium and then through the valve to the right ventricle so that it can be pumped back to the lungs to be reoxygenated. So that's kind of how the whole system works. But this is just another example of how different the right ventricle is on these guys. So the left ventricle is much thicker. This is kind of a cross section here of this cockatoo heart. The left ventricle is much thicker because it has to pump with greater force to push blood through most of the whole body. And the only thing that the wimpy right ventricle has to do is pump blood to the lungs. So it is much thinner walled, it's not as muscular. But one of the weird things about birds is that it's kind of wrapped around and kind of hugging the left ventricle. It's what we call kind of a crescent shape chamber. So just kind of made a little bit different than us, but still the basic function, rules apply. There are arteries. I don't expect you guys to, remember all these big names and stuff, but probably the most important thing is that the aorta is what comes right out of that left ventricle, and it comes right out of the heart, and then it divides into some other big arteries that have big destinations. So in parrots, the biggest arteries are the brachiocephalic trunks. I'll show you kind of a little picture of that. Each one of those, it splits off the top of the heart here and it goes to the wings. And it also puts up the carotid artery that goes up to their brain and head. From there, it divides into smaller arteries with different names, like the subclavian, pectoral trunk, etc., going to the pectoral muscles and then off into the wings. So you can consider these two big honkers, these two big arteries that come off like this, to be supplying kind of wings up, basically. We also have a pair of big arteries that deliver the blood from the right ventricle to the lungs to get reoxygenated, and those are called the pulmonary arteries. And then from there, after the aorta puts off these big old brachiocephalic trunks, it continues on south and puts off extra branches to the liver and to the GI tract and to the kidneys and all of the organs kind of below the wings. So this is just kind of a schematic of what that looks like. You have your heart here, here comes the aorta, and then it's going to take a U-turn and it's going to head down south and start putting off branches to everything below the wings, more or less. And then you have these two big brachiocephalic trunks that put off arteries to the pectoral muscles and then off into the wings. And very importantly, they put off these carotid arteries to supply blood to the head and the brain. Goes off into the wings further along, and it divides into smaller vessels as you get toward the tip of the wing. And then that descending aorta puts off branches to the GI tract, and then these are the kidneys here. There's a bunch of branches that go to those guys and branches that go to the legs. And so all of this is important because when we have atherosclerosis or hardening of the arteries, there can be blockages in some of these arteries, and it can be variable places. Like maybe, this is pretty clear here, but this one's blocked, and it can affect the blood flow to this particular leg. So where the plaques are and where the artery wall is the most thickened and the blood flow is limited, wherever that artery is supposed to go and supply blood and oxygen to which tissues or which limbs you're talking about may be underserved. And so the symptoms can reflect that. And we'll talk more about symptoms here in a minute. So this, again, kind of a little bit more information than you really need as far as this entire schematic. But what I wanted to point out was how atherosclerosis affects the way that blood moves around the body and how it affects the heart. So cardiac output is what we're referring to when we're talking about how much blood gets pumped out effectively out of the heart through the arteries into the destination. And what works against that is something that we call afterload. And what that means is that anything that resists or impedes the blood being pumped out and forced through those arteries, reduces the amount of blood that gets to its destination ultimately. And what's important is when birds have atherosclerosis, a lot of things happen to those arteries downstream, the tributaries downstream. You get narrower arteries that put up more resistance to blood moving through them. And so it kind of puts a more work or more load on the heart. It causes less blood to get pumped out and to its destination. The same thing happens when those big arteries, that aorta, those brachiocephalic trunks are supposed to be really elastic and stretchy and accommodate blood as it goes through. But with hardening, they get very, very stiff and they don't stretch like that anymore. So they're putting up more resistance to the heart trying to pump the blood out and get it through the arteries. So all of those things come into play, and it really increases load or work on the heart. And over time, it can begin to weaken and tire out and fail. So now we're going to talk about, like, well, what does this look like? What do these diseases look like? You know, what kind of symptoms do we see? What kind of things do we see on physical exam, stuff like that. So again, atherosclerosis is really common, particularly as birds age. But we do wonder if there are some genetic factors to it, because it occasionally appears in pretty young birds. It's probably multifactorial, and we'll talk about that in a minute. But it's probably one of the most important diseases that we deal with in our companion parrots. And reports state that it's the most common postmortem finding, so on necropsy, that you might find in as far as cardiovascular disease in companion parrots. And then you're like, okay, well, I hear this term hardening of the arteries and atherosclerosis. What exactly is that? The short version is that you basically have chronic inflammation and degeneration or damage to the lining and the wall of the artery, which then becomes thickened and hard and firm. And you can even have plaques that kind of bulge out into the passageway. So forgive the gross picture, but this is what these arteries look like when you cut them, when those walls are very, very thick. So this is a cockatiel that's like about 30 years old. Those guys often have atherosclerosis, and these are those two big brachiocephalic trunks. And here's the little aorta as it's about to take its U-turn and go down south. So one thing we think about with like stroke in people is people like forming blood clots in their arteries, like having to do with atherosclerosis, and then those clots breaking off and going downstream and causing a blockage, an acute blockage, like in the brain or things like that. Those things can happen in birds, but clots is actually less of an issue in birds as we understand it. Instead, what's happening is that the arteries are simply getting so narrow that blood's having a hard time getting through them. And so the tissues that the blood is supposed to get to and bring oxygen to are getting starved of blood flow and oxygen. That's what we call ischemia. Thrombosis refers to clots, and again, that seems to be the minority for them. They can, like have an aneurysm that busts or things like that, but it seems to be relatively more rare. And the more important reason that they have the symptoms that they have, sometimes we refer to those symptoms as stroke, sometimes they are described other ways, but the symptoms are mainly because your arteries have become too stiff, too narrow, and from one heartbeat to the next, there may be a deficit in how much blood gets to its final destination. And we can see atherosclerosis anywhere. I mean, the most obvious places are the big obvious arteries, and we definitely see it in those pulmonary arteries going to the lungs. We see it in the brachiocephalic trunks and the aorta, but we also see it quite a bit in the smaller arteries like the carotids going up to the brain, and also the arteries that go to the GI tract and the kidneys and the legs. And so the way it manifests, disease manifests, depends on kind of which areas are being the most underserved. This is an example of two brachiocephalic trunks that are literally completely blocked with plaques. And it's kind of unusual that you see them this bad, but it does happen. And this was in a 20-something-year-old Amazon parrot that had eaten mostly enchiladas through its life. And unfortunately, this is what we see happen from that. This is a lovebird, kind of like later teens, which is quite old for them. And the arteries are so hard and stiff that they almost kind of stand up by themselves. These are the carotid arteries that are supposed to be supplying blood up to the brain. So this bird had some problems with brain function and basically stroke. And even the descending aorta that goes down and puts off its branches to the legs and the kidneys and all that can get all these plaques in it, and it can be narrowed and limited flow going through those branches. So again, like how this looks depends on which vessels are most affected, and also if maybe the heart's starting to tire out and it's not working as well as it used to. Unfortunately, sometimes the first symptom is they just suddenly die. Like you wake up in the morning and they've passed overnight or something like that. And that can happen when you have maybe a big stroke. You might even have an aneurysm that blows, even though that's not super common. Or it could be that your heart is having enough trouble, maybe because it's not getting blood to itself through the little coronary arteries that are supposed to give it blood and fresh oxygen. And it has an arrhythmia and then stops. Aside from sudden death, the symptoms can be really, really vague, unfortunately. Like they just are kind of slowing down. A lot of people describe that to me in their older birds, that they're just slowing down, becoming lethargic and weaker, maybe not eating quite as much, or they used to fly 2 laps around the room and now they get winded after 1 lap, things like that. We might start to see some wasting of their pectoral muscles. Sometimes that's because the muscles are not getting as much blood as they used to, and they start to atrophy. And I've even seen some weird things where the feather follicles weren't getting blood flow anymore, and they weren't growing properly anymore. And also the GI tract may not move and function and have normal motility if it's not getting good blood flow. So this is that same Amazon I showed you that had like the totally blocked arteries. He stopped being able to grow feathers on his wings and his head and his face. And that was because he wasn't really getting any blood up there at all. It was amazing that he was alive, but they're tough guys. So we also see this kind of stroke type scenario. Usually it happens suddenly, kind of acute onset. Sometimes the symptoms seem kind of fleeting. Sometimes they're more lasting. People might notice that their bird falls or collapses, and even maybe even transiently can't use a leg normally or something like that. They may be out of it, disoriented, they may have a head tilt, or they may even have seizures, or their pupils are different sizes, or things like that, because the brain has been affected. So those are some of the things we see with stroke with these guys, and that's how they sometimes present. So prevalence and risk factors, the take-home point of this slide is that African greys and Amazons and cockatiels are statistically more likely to have advanced atherosclerosis as they're older, as they get older. In my personal experience, the greys and the Amazons, as they get over 20 years of age, tend to be, the most likely to present with problems. And then after that, cockatiels, lovebirds, Eclectus, and I even know cockatoos and macaws statistically are supposed to have less atherosclerosis. I still feel like I see a lot of that in practice. Has that been your experience also, Dr. Lamb, or have you seen other patterns?
Yeah, I would say for sure the African greys seem to be number 1 and closely followed by the Amazons.
Yeah.
But I too agree that I see more macaws with it than what the literature would maybe lead us to believe.
Totally. I think so too. Yeah. So anyway, these are some of the things that we believe contribute to that. There's some studies to support these ideas. So high calorie and fat diets, like through their lives, it's really not too different from people, realistically. High cholesterol, And cholesterol comes from animal-based foods. So things I oftentimes hear are like cheese and meat, and maybe other forms of dairy. And then, or also something I'm oftentimes told is, oh, if I give them we're eating chicken wings and I finish the meat and I hand them the bone and they'll crack it open and eat the marrow out. So that's something I also hear quite a bit from people. Limited physical activity. This is probably really big. I think it is. There's little information out there as to whether atherosclerosis appears in wild birds, but what I have read suggests that it doesn't seem to show up in them in the same way that it does in our pet birds. But also they are athletes. They're designed to fly for miles and miles every day, and in captivity they're quite sedentary. And that's likely a large contributing factor. Female reproductive tract activity, so let's say a bird that's chronically laying eggs through its life, they are also predisposed to atherosclerosis because of the effects of estrogen, which alters levels of cholesterol and triglycerides in a way that favors the formation of plaques. So these are some of the major risk factors that we see. Dr. Lamb, anything that comes to your mind to add to that from what you've experienced?
No, but it did make me think of one funny thing is, as you mentioned, there's not much reports of it in the wild birds, but I can think of when I lived in Connecticut. I remember diagnosing atherosclerosis in a seagull, which, you would think like, why would a wild seagull have atherosclerosis? But then you think about what seagulls do and how they hang out on the beach and steal people's food. So
there you go.
Eating stuff inappropriate. Yeah.
Yeah. No, that's a really interesting anecdote for sure. Yeah. But they're eating a lot of what we eat, right? And that can not necessarily be so good. So typically what I have noticed in practice, tell me if you've seen anything different, but basically birds that have had like a long chronic history of high calorie and fat diets, and may in fact have been obese for years, that have enjoyed a lot of animal-based products, like you see the Eclectus with her chicken bone, she's going to crack open and eat the marrow. And also those that have had females that have had chronic reproductive activity. Those seem to be the guys that are most represented with this disease.
Yeah, I would agree. Same scenario.
So when it comes to heart failure, we talked a little bit at the start about congestive heart failure or CHF. I feel like that's kind of the most common scenario I see, but there's also something called low output heart failure. And so the difference there is that in both cases, the heart is not doing a very good job at getting blood pumping out. So the cardiac output, or the amount of blood that's being pumped out with every beat, is diminished. When it comes to CHF, though, what's happening is that you also get a lot of fluid retention, essentially. The body tries to compensate for having cruddy cardiac output and blood not moving around well by making more blood in a way. And so you actually have more volume that now the heart has to try to pump around. It can't keep up with that. And so fluid begins to accumulate in places. So when you're talking about just kind of plain old low output heart failure, maybe you don't have fluid building up in places, but you just have really crummy cardiac output. You have kind of generic signs of like, I'm lethargic and weak, and that's about it. But then when you have congestive heart failure and you have fluid building up in the belly, which we call ascites, in the lungs, which we call pulmonary edema, and even in the sac around the heart, which we call pericardial effusion, the symptoms can relate to issues there. They even sometimes have peripheral edema. You think about like fat ankles, like, maybe, a 9-month pregnant lady might have some edema in her feet or legs. Sometimes that appears in birds. It's pretty uncommon, but it does. But they have breathing problems a lot because they have fluid in their lungs, or they have fluid in their belly with ascites that's compressing their air sacs and they can't ventilate. specifically. And also when you get enough fluid around your heart in the sac around your heart, it kind of strangles out and squeezes it and makes its function even worse. And so those birds can be extremely short of breath and weak, and having trouble breathing. So birds also are more prone to pulmonary hypertension and right-sided congestive heart failure compared to mammals. And what pulmonary hypertension is high blood pressure in the lung circulation specifically. And it's the right side of the heart's job to pump blood into the lung circulation. And if the pressures are really high, it's a lot more work to have to force blood through those lungs. So there's a number of kind of anatomical reasons that birds are more likely to have pulmonary hypertension. And because it's the right side of the heart that gets the most strain in that scenario, they seem to be more likely to develop right-sided congestive heart failure than left-sided. And that's where basically the right side kind of begins to weaken and fail, and it isn't getting blood to the lungs very well, and everything's backing up. The left side's like, hey, you're not doing your job, we're doing our job. And so blood begins to back up in the rest of the body because the right side isn't pumping it forward into the lungs. And then the opposite occurs with left-sided congestive heart failure. It's not, the left side's not doing a good job pumping blood to most of the rest of the body, and everything's kind of backing up in the lungs and backing up on the right side. And they can have a combination of the two. So something that has been really interesting for me in practicing here in Colorado at altitude is because of the high altitude and the lower oxygen in the air, people and animals and birds have a higher incidence of pulmonary hypertension related to that. So I'm seeing a lot more pulmonary hypertension and its consequences like right-sided congestive heart failure here at altitude than I ever did at sea level. And so I'm seeing birds that have shortness of breath, and they're having trouble oxygenating, and they may turn kind of blue. This is a now passed away, unfortunately, really cool big rooster named Biggie, belonging to a client friend of mine. And you can see how he's kind of purpley here. And so he had trouble getting oxygen into his blood, and he would kind of turn purple. And then what they do is they make more red blood cells to try to carry more oxygen. And then they have a higher percentage of red blood cells in their blood. And so their blood kind of gets thicker. And then that can make the whole thing a little bit worse. Dr. Lamb, do you feel like you've encountered or had reason to believe that you got pulmonary hypertension in some seasons? I feel like I saw a smattering of that at sea level in California, but here I'm just seeing so much more.
I think I see it sometimes, but I don't think I see it to the level that you do when we discuss cases. It seems like it's not as common of a problem here in Arizona. It happens, but maybe not with the frequency that you're getting it.
Yeah, because you guys are at sea level, I think, too, right?
I mean, I think we're a little bit above, but not substantial.
Gotcha. Okay. So what are the symptoms that we see? Well, so as I mentioned, when the left side of the heart is failing, and fluid is backing up in the lungs, they have a lot of trouble breathing. They may be turning blue, gasping, open mouth breathing. They get out of breath very easily. When the right side isn't working, that's when they start having fluid build up in places. Their organs also get really backed up with blood, and so they get congested and enlarged. And then on a physical exam, I'm going to notice maybe that their belly is distended because it's full of fluid, or that they're having trouble breathing because of that. And I might even see edema or fluid in the tissues, like in the ankles or things like that. So where does atherosclerosis fit into this? Well, so we mentioned when I was showing you that kind of little graphic that when your arteries are narrower, they're harder, they don't stretch open and accept blood. It is a lot more work for the heart. And so the heart basically, it's overworked for a long time. The muscle of the heart begins to thicken because it has to produce more force to force blood through those narrow arteries. And so the muscle thickens just as your bicep would get bigger if you're lifting a dumbbell. And so that's what we call hypertrophy. That's something I see a lot here, just because of atherosclerosis, but also on the right side of the heart because of pulmonary hypertension at altitude. So as that heart gets thicker and more muscly, more like a bodybuilder, it actually doesn't work in the long term as efficiently, and it can't fill with as much blood. So that's when you get this so-called hypertrophic cardiomyopathy, and eventually the heart just doesn't work as well as it used to. So another factor is that, as I mentioned earlier, the little tiny arteries that serve the heart itself. So when the heart beats, some blood goes to itself because it needs oxygen as well. And those coronary arteries can get blocked too. So when we think of that causing a myocardial infarction or so-called heart attack. We do think that happens in birds, but probably not to the extent that it does in people. But anyway, if the heart isn't getting served with enough blood and oxygen, it doesn't function properly. And these are kind of the things that happen when you get damage to the heart because it's not getting enough oxygen, almost like a heart attack in slow motion or chronically over time. The heart muscle begins to become damaged and deteriorate, and then it doesn't work as well, and you have arrhythmias, and those things can be life-threatening. This is just a slide about how the body kind of expands the amount of blood volume to try to get more blood to more places, but over time it just overloads the heart even further, and that's where you get fluid building up in congestive heart failure. So diagnosis, this is from a comic that I really like called The Oatmeal. It's online, and he has a story of the Grump is the name of his gray parrot that he remembers them having when he was a kid, his family having, and he had a terrible diet. You know, he was kind of joking and saying, well, he ate a lot of like chicken and chicken bones and Skittles, and then when he inevitably suddenly passed away unexpectedly and they found him deceased, they're like, well, what was it? Was it that he ate lots of chicken and was a cannibal, or was he ate lots of candy and he's a diabetic? Like, what was it? But unfortunately, I feel like we do see this a lot in real life. So when I'm trying to make a diagnosis, I think about the history. So what are the predisposing factors in this patient? This disease is very sneaky. Generally, it very slowly develops over time. And so symptoms can be they don't arise until things are more advanced, and also they are very gradual and vague. And so I'm on high alert when I do an exam or talk to an owner of a bird that is of a certain age, because a lot of times people say, oh, they're slowing down. And I'm like, okay, well, what does that mean? Let's find out exactly why. So something I always have people watch out for is, even if you think they're just slowing down, like even if it's something subtle and you don't even think it's important, mention that to your veterinarian when you go bring them in to be seen. But I like listening to people like, is their energy level lower? Are they weaker? Maybe they can't sustain as long a wing flapping or a little flight anymore. Falling from the perch at night is a big clue, so I'm always listening for that. But I've also had people say things like, oh, well, his favorite food's always been peanuts, and just recently he just doesn't really like peanuts anymore. Like little things like that. Or he always rang this bell and now he doesn't. Those are sometimes the only symptoms we get. So I tend to jump on those kind of details and recommend a diagnostic workup. So we're not going to go through these things in too exhaustive detail because we need to have enough time for to also hear from Dr. Lamb about some preventative things. But anyway, the main things we look at are X-ray images, ultrasound, and we're even able at the Arizona practices and also in Colorado to do CT, and angiography where we put contrast in, and that allows us to see the arteries with much more detail even than X-ray. But this is an example of a bird that has a really enlarged heart. You saw that X-ray at the beginning of the presentation showing the heart, and you can kind of see how big and fat that is. And also the lungs, if you're much brighter than they should be, that's because there's fluid in that. Again, x-rays aren't very sensitive when we're looking for signs of atherosclerosis, but what we're looking for is increased density, so they look brighter to us. And also sometimes there'll be plaques that are mineralized and you can really see them. So here's an example of that. One of the things we look for in this aorta, it comes up like this and it takes a U-turn and then it goes on down, is it's kind of like I say, jiggity, meaning it's kind of going back and forth, back and forth. We call that tortuous. And that happens when it gets hardened, and then you can even see some spots where there's actually some mineralization of the wall there. But like you saw in that other x-ray, you can have fluid in the lungs, you can have fluid in the belly, which removes the detail and you can't see the other organs very well. When we're using CT, it's an advantage over X-ray because we can see everything in 3 dimensions without an overlap of the other, like the ribs and the wings and other things. So this is an example of some mineralized plaques here in the aorta of this bird. When we put contrast in, and that's called CT angiography, the contrast agent fills in the inside of the artery. It goes wherever the blood goes. And so it lights it up and makes it clearer. And you can see here that there's a plaque that is bulging in to the passageway and narrowing it. On this particular guy, we've got contrast in there. The heart's down here. And all of this is fluid around the heart and the sac around the heart. So that's what pericardial effusion looks like on a CT. You saw that a moment ago. This is an example of what the end-on aorta can look like when it is denser and hardened, and it's just a lot more obvious. And there's some more mineralized lesions that you can see on a CT. Ultrasound's huge too. I use cardiac ultrasound all the time, or what's called echo, to see inside the heart. On those x-rays, you can see how you just see the sound of the heart, the silhouette of the whole heart. You can't see the chambers inside and the valves inside and things like that. And so that's where echo or cardiac ultrasound comes in. So treating this, it's tough because, generally these conditions aren't curable and we're having to try to improve quality of life, control symptoms, improve life expectancy, but we're using tools that don't have a lot of information in the literature about. There's not like a lot of controlled studies and things like that. So we're extrapolating a lot of the treatment from how is it treated in dogs and cats and how is it treated in people. When it comes to atherosclerosis, controlling risk factors, I think, is really, really important. And that's where some of the things that Dr. Lamb's going to talk about come in is, okay, you might also think like, okay, I have a 1-year-old African gray parrot. I know now that their species is at higher risk. It's extra important for me to make sure that I don't overfeed and provide too many calories or high fat percentage of the diet, keeping them from being overweight. If they're a female bird, doing what we can to minimize reproductive activity. Providing opportunity for exercise. So maybe we don't clip the wings on these young birds. We let them fledge, we let them learn to fly, and then we provide opportunities in the home in as safe a situation as we can for them to fly. It's also good for enrichment purposes. A lot of people ask about, well, what about things like Lipitor? So those kind of drugs are called statins. They may, there's enough research now that it looks like they might have some value in slowing progression of atherosclerosis, but they're not mainstays of treatment at this time. So a lot of what we do, though, is treat patients that already have atherosclerosis. We can't fix it. We can't cure it, make it go away. And so we are treating symptomatically with medications that help dilate blood vessels and improve circulation, get blood moving more easily past blockages. And then also it may not be safe for them to do a lot of exercise at this point in their life. Maybe exercise restriction is more appropriate. Maybe we have secondary heart failure that we're also having to manage. Or let's say they had a seizure because of a stroke and now they have some neurologic deficits and they need a special housing set up to accommodate that. So with atherosclerosis, a lot of what I use to address it symptomatically is peripheral vasodilators. And what that means is drugs that dilate blood vessels downstream to kind of make it easier for blood to move through the system and get past blockages. Some of the big drugs we use for that, some of you may have heard of isoxaprine. It's used also in horses as a peripheral vasodilator, and it can really, really help improve blood flow to the end destination, to the brain, to the extremities, and help a lot of the symptoms that we see in these birds and reduce stroke risk and stroke severity. Enalapril is a so-called ACE inhibitor. Sometimes we use it together with sildenafil. Sildenafil is a vasodilator that works great in the lungs, so it's really good to reduce the pressures when you have pulmonary hypertension. But ACE inhibitors like enalapril, they also help the body stop holding onto as much fluid. And so that's a major thing that we use in treating congestive heart failure. Pentoxifylline, this is a weird one. So what this does is it makes red blood cells more deformable. And so it's easier for them to kind of slip and conform and move around blockages. And so I like to describe it is it makes your blood less viscous and it kind of slides through these arteries better. And so I almost think of it as making the blood more slippery. So we sometimes use that in combination with these vasodilators. Again, statins, there's some research to suggest maybe there's going to be some value in using Lipitor in particular in high-risk patients. If those that have high cholesterol on their blood work year in and year out, and I'm already suspicious they're of a certain age, I'm already suspicious they have atherosclerosis, I might consider a statin. As I mentioned, we have to support these guys when they have neurologic deficits and when they're not eating for a while, and we have to, when they have a stroke, and we have to step in and support them. With congestive heart failure, a lot of the same things are true as treated in dogs and cats and in people. In addition to using things like ACE inhibitors to help keep the body from retaining as much fluid, we also use diuretics to help the body get rid of this extra fluid as well. Sometimes we even have to drain some fluid out if there's a lot that's built up in the belly. Again, we don't expect to cure them. We're trying to control the disease. We're trying to get the heart back into a better functional state and get all of these extra fluid buildup problems under control and then keep it that way as long as possible. And some birds don't respond very well at all. Most birds do respond to a degree, but you might get a few months or you might even get a few years. So it really depends from patient to patient. I'm bringing this up because this is something that I've had to utilize quite a bit here at altitude in Colorado. I'd mentioned how they make more red blood cells, are trying to carry more oxygen, but it just makes the blood thicker and more viscous. We actually do blood thinning procedures where we take out some of the blood and then we give them fluids to replace the volume, and it thins that blood out. So it's not as thick and sludgy and it can move through better. So this is something that's been very, very helpful here. It is reported in the literature. That's where I learned about it from, and then I've utilized it quite a lot. So again, this is the last thing I'll say about dietary modifications. We want them to have good nutrition. I think it makes sense in birds with heart failure to limit sodium. I mean, we kind of limit sodium anyway, just as a good practice, but I think it's extra important for them. We don't want them to be obese. We want to try to resolve that, and we want to not overdo fats and calories. I also always counsel people to not feed animal-based foods, hardly at all, like egg, meat, cheese, things like that, or they're very, very rare. There is some evidence that supplementation with omega-3 fatty acids, like those found in flaxseed oil, can slow progression of atherosclerosis. But Dr. Lamb is going to go into a lot more detail about that kind of thing and also other things that might have preventative or treatment value as well.
All right. Brenna, did you want me to, since you have the slides, do you want me to tell you next slide when I'm ready for the next slide? Okay. All right, great. All right. So thanks for letting me be a part of this today. What I'm going to talk about is thoughts for the future of maybe some research that we really need to do in birds to find out how we can better help these birds with atherosclerosis and try to prevent it as best possible. Because, as Brenna just told us, this disease, when we get to the point where we're having to treat it, we have these medications, but it's so much better to prevent disease than to treat disease. We want these birds to have good quality of life. We want them to be living the long lives they're meant to have. And when it's cut short because of atherosclerosis, it's really sad. And so my hope with talking about some of this is that it gets people thinking about what we could do to be better to prevent problems. A lot of what I'm going to talk about is really based on information that we have on mammals and then chickens, because chickens are sort of the main bird that we have scientific studies on, because it's easier for people to do scientific research with chickens than it is sometimes with parrots. Now, a chicken is not a parrot. They are definitely different. So just because something may apply to a chicken doesn't necessarily mean it's going to apply to a parrot. But at least it's a starting point for us to consider where we could move towards in the future to help these guys. So next slide. Okay, first thing I'm going to talk about is fish oil, which Dr. Fitzgerald set me up perfect for that, because she was just mentioning flaxseed oil. Flaxseed oil and fish oil, they're both omega-3 fatty acids. And there is research on the mammalian side of things that does show that they are really helpful for cardiovascular health. They help to reduce inflammation, they reduce inflammatory mediators. With atherosclerosis, there's still a lot we need to learn, but when we look at mammalian models, what we see with it at the level of the microscopic level, when we have a cut section of a blood vessel and we look at that cut section of a blood vessel, we see that we see inflammatory cells within those plaques. And so while it is this fatty disorder, there's also an inflammatory component to it as well. And so these omega-3 fatty acids can help reduce some of those pro-inflammatory mediators that lead to atherosclerosis developing. They may also reduce vasoconstriction and thus plaque formation. Now, there's several papers that have looked at omega-3 fatty acids in different avian species. Quails, chickens, swallows, gulls, and psittacine birds, thankfully, do have a little bit of information. Next slide. Okay, so particularly in psittacine birds, because that's what we're most interested about on this talk, there's a couple of papers that are out there. There was a study in parrots that had passed away, and that they looked at those birds after they've passed away. They were looking for evidence of atherosclerosis, and they found that those that did not have atherosclerosis actually had significantly higher levels of alpha-linolenic acid, which is an omega-3 fatty acid, in their breast muscle and in their fat tissue. So that led those authors to believe that, well, maybe if you have higher levels of these omega-3 fatty acids, that might be a preventative factor for the development of atherosclerosis. Another research team actually looked at adding omega-3 fatty acids to the diet of cockatiels to see what it actually did to their fat levels in the blood that they could measure, their cholesterol and their triglycerides. And they decided to look at a couple of different types of omega-3 fatty acids. So they looked at fish oil and flaxseed oil, but then also, because research doesn't want to be biased, they decided, let's not look at an omega-3, let's look at an omega-9 as well, because who knows, maybe omega-9s could potentially be helpful. We don't know. And so specifically for that, they chose beef tallow. And when they gave these cockatiels these 3 different types of fats, they then looked at their fats in circulation afterwards, and they found that those that had received the fish oil had greater reductions in their cholesterol and triglyceride levels compared to those that had either the flaxseed or the beef tallow. So that was just also suggestive that maybe that's something that's going to be a little bit helpful to, because we know that, or at least there are links between high fats in circulation and this disease developing. So maybe we need to have this more in the diet of these birds. Okay, next slide. Now, every other thing that I'm going to talk about beyond that, the fish oil, every other thing, I do not have data in psittacine birds. So a lot of this is going to be again, mammalian focused and chicken focused. But the point of it is for us to at least think about these things, because just because it's focused on mammals, the research is focused on mammals, research is focused on chickens. These are things that maybe we should say, maybe we should look at this in psittacine birds and think about adding these things to the diet in some way, because maybe these things will be helpful. Maybe this is the link that we're missing, because Dr. Fitzgerald, let me know if you've had a similar experience, but I definitely have had older birds that have been on a relatively good diet, though the vast majority of them, when I diagnose atherosclerosis, have some history of what we would consider poor diet that's high in fats. I have had patients that have been on what we believe to be a good diet. And yet they're still developing this disease, maybe not at the frequency as those birds that are on the really high fats diets, but it still seems to happen in these birds. So
100%.
Okay.
100%, which is, kind of dismaying, right? Because it's like, we're like trying to do our best and we're feeding, pellets, and we're feeding fruits and vegetables and things like that. But yeah, we do see it quite a bit regardless. I think a couple of things are at play. I think one is that captive diets, even when they're as good as they can be, are still not don't mimic wild diets very well. So like the
Right.
kind of, so the kind of produce, if you will, or veggies and fruits or seeds and stuff that they might find in the wild are still going to differ quite a bit from what we have to offer here. And then also, as pellets, as Dr. Pilney pointed out in the webinar a couple of weeks ago, it's like pellets still contain a lot of seed and other things. That's part of what's in them. They also, have the right balance of vitamins and minerals, or they try to, and that's a big part of their value. But the fact is, what they're eating is still really different from what they would eat in the wild. I think another factor is the relative lack of exercise in captivity. I think that's really, really big.
Yeah, I would agree on that for sure. I talk with owners all the time about, even if the bird is allowed to fly, it's still not like in the wild, when they're having to fly away from a predator that shows up or competition. They're going to various different environments, in their entire area where they hang out, to exploit food sources and do different things throughout the day. So there's just so much more exercise than what happens in our captive environments. So I do think that plays a huge role. But to go, back to the diet stuff, maybe these are things that, who knows, in the future, maybe somehow they'll be incorporated in some degree into, whether it's adding them to the fresh component of the diet that people often feed their parrots, or somehow added into pellets in the future, who knows, that might prove to be beneficial. So ginger in particular has been shown to have various health benefits. It reduces inflammation, which again was something we talked about in atherosclerosis. We have that inflammatory component to it. It also acts as an antioxidant. It reduces platelets aggregating together. Although we know we don't have as much of those clots forming in birds with atherosclerosis, it is still something that can happen. So maybe reducing those things from good. It can have beneficial effects on reducing hypertension and also counteracts those high fat levels in the blood.
I wanted to ask Dr. Liam, I'm sorry to
Yeah,
cut in. I just wanted to ask, have you found a way, or have you experimented with incorporating ginger into the diet in any way?
I mean, so like for my own personal birds, while I feed pellets as a mainstay of their diet daily, I do also add in chop. And I don't do ginger every single time I do chop, but I will chop up little pieces of ginger and mix it in, fresh ginger with their chop intermittently. And then also Lefebvre's has the senior nutriberries, and the senior nutriberries do have ginger incorporated into it as well. So there are a couple of ways you can do it. Now, I will also say on these slides, I have a lot of like scientific detailed information. I'm not going to go into in depth of all of that. I just have it on these slides for those people who are really interested about knowing the mechanisms of why these things could potentially be helpful for atherosclerosis. And it's also, it goes back to when we look at those cross-sectional areas of a atherosclerotic plaque in a blood vessel underneath the microscope, the different cellular changes and components and things that we're seeing, it's really at that microscopic level that some of these things are having a beneficial effect. It reduces these things called foam cells. So basically on that microscopic level, when fat gets into like the blood vessel wall, macrophage, which is a type of inflammatory cell, will say, hey, that's not supposed to be here. And it sort of engulfs that fat. And then it turns into this thing called a foam cell. But then that foam cell just kind of sits there and it is essentially part of this whole plaque that's in that wall of that blood vessel. And so ginger has been found to reduce those. It also reduces, and this is definitely something we talk about way more on the mammal side of things, and people will know about because, you know, if you're going to the doctor and you're diagnosed with high cholesterol, you'll often have these lipid panels done where you're going to look at HDL and LDL and VLDL. And while we have those in birds, there's still a lot we don't quite know about them. So I don't know about you, Brenna, but I don't use them a ton. Every once in a while I run them because I'm like, I wonder what this is going to tell me, but I haven't found them to be super helpful for me yet, but that's probably because we need more research to really know how helpful they are.
Yeah, that I agree. That's the thing. It's like we don't, we also know there's probably big species differences. So even if like somebody publishes a paper where they're like, this is normal, LDL and HDL and VLDL in like the cockatiel, that doesn't mean that that can be extrapolated over to an eclectus or something like that. And so I'm like, until I have a better understanding of what normal really is, I don't really look at those numbers. What I do look at, though, just kind of as a regular part of routine blood work all the time, is total cholesterol and triglyceride levels. Which, you know, if you want accuracy with that, they ideally should be fasted for a while before you take your sample because that can give you some false elevations. But we know that if they have high cholesterol on blood work once or twice or high triglycerides, that is not diagnostic of atherosclerosis. A lot of people think that, or they're like, oh, you have high cholesterol, so you must have atherosclerosis. Not necessarily. I just kind of view it as a risk factor, and especially if I'm seeing it chronically. So every time I do blood work on this bird over the last 10 years, there's high cholesterol. And also, P.S., he's getting a lot of egg to eat and he's obese and things like that. I'm like, okay, I can just add this to the pile of risk factors.
Yes, I totally agree with that. Okay, so let's go on to the next slide where there is at least a little bit of information about ginger and its effects on things like cholesterol and our fats in birds. So in chicks, so broiler chicks, it's a chicken, right? It's a baby chicken, a chick. But broiler is a particular type of chicken that's going to be more of a meat chicken. So then we have our laying chickens, which are going to be producing our eggs for us. And then our meat chickens are our broiler chickens. And our broiler chickens are bred to grow really fast, really big. And if they go beyond a certain age, they get really fat and are experiencing quite a bit of health problems. So there have been studies in them looking at cholesterol and triglycerides, and ginger has been added to their diet at varying levels. And you can see it here, 0.1 or 0.2% of the diet. And when that has been done, it has shown drops in cholesterol and triglycerides for these birds. Same thing with laying hens. Studies have been done in them as well. Now, doing it a little bit higher for a little bit longer period of time, but their cholesterol levels will drop when they get ginger in the diet. In rabbits, now again, a mammal, not a bird, but in rabbits where they have experimentally induced atherosclerosis to develop in them, they then gave ginger to these individuals for a period of time. And then they culled those animals, looked at atherosclerotic plaques in them, and they found that those individuals that got ginger for that particular dose for that particular period of time actually had 50% inhibition or the development of those atherosclerotic plaques, which is really kind of cool, you know? Again, not a bird, but there's at least some evidence to support that, hey, maybe this could be helpful for us, and maybe we should be thinking about this to the diet of birds.
Yeah,
okay,
and so I'll advance in just a second. Quick question or comment. So what's not happening necessarily is that existing lesions are regressing or going away. Like I think we're kind of looking at just trying to prevent their development in the first place
Absolutely.
or slow their progression. The other thing is, when I think about what is 1 to 3% of the diet really look like, right? Like if you're trying to like measure an amount or like how much you would feed per body size or something like that, it's kind of hard to get your head around that. And I also wonder, like, would that be kind of quite a bit? I feel like if we did that in a parrot, would that mean that they're literally eating like a tablespoon of ginger a day? I'm not sure how that would
Right. We'd have to
extrapolate
really...
or how doable, would it be? I really like your idea of just quite simply incorporating some ginger into the chop. I mean, you can't hurt doing that. But I think it is hard for us to know because there's also not studies on citizens, how much should we give them?
Right, exactly. And that's going to be the case for all these things we talk about here. Is the vast majority of these things are for preventative reasons. These are things that probably aren't going to be too helpful once the bird actually has atherosclerosis. But again, prevention is prevention is what we want to go for. Prevention is what we are trying to do to make it so we don't have these problems and quality of life issues developing in these birds. So,
and then maybe once we recognize them too, like we could slow progression.
Yeah, absolutely. Okay, you want to go on the next slide? Oh, okay. So next thing is ginkgo. And ginkgo, now I personally have not used this in any patients or personal pets or anything like that, but there is evidence in the literature to support that it may be helpful. In humans, we know that humans, when they have atherosclerosis, they can get this condition called intermittent claudication syndrome. And so what that is basically if you've got these plaques developing in the limb, the vessels going to your limbs, you could potentially get this sort of like painful, numbing, like issue with the feet. And we definitely see that in our birds. There is a publication out there of a case in an Amazon where it was suspected. And that picture that you have of that African gray earlier in the slides here, where its feet are all knuckled and kind of off to the side, it wouldn't be surprising if that bird was experiencing some level of intermittent claudication because it has plaques in the vessels leading to those hind limbs and causing some level of discomfort or disuse by the bird. So in people, they actually have isolated a particular component within the ginkgo leaves because there's different substances. When we think about natural food items, there's lots of stuff inside of those items. It's not that they contain just one thing that's beneficial. There could be multiple different compounds that are beneficial. And so in studies with people, they have identified various different compounds that I have listed here that may actually be beneficial. And one in particular that has a very weird name, EGB 761, and studies in people have shown
Good
that
old EGB 760.
Yeah, exactly. When people get that, it does help reduce small plaques that are formed with atherosclerosis. It helps reduce pain. It causes sort of an increased vasodilating thing to the limbs. And those people who have that, they actually are able to walk longer distances with use of this than without. So interesting thing. Maybe this isn't something that we're going to necessarily use for prevention, but maybe one day in the future, it is something that we're going to be looking at for those parrots that are dealing with intermittent claudication from atherosclerosis. We can go on to the next slide. But as I mentioned in that previous slide, there's other compounds. There's one called gingectin, and that in studies in rats, so a mammal, not a bird, but studies in rats do show that you can get stopping the deposition of lipid in the aorta and also having reduction in those fats in circulation. A study in chickens was done and also showed that there was a reduction in triglyceride and cholesterol levels. And it may actually stop the expression of genes that are involved in lipid production. So working more at the cellular level. Right, so cinnamon is the next thing. There are some studies in cinnamon that show it has a protective factor against atherosclerosis in mammals. So with atherosclerosis, again, when we're looking at it at the cellular level, at that blood vessel. The inner lining of the blood vessel is called the endothelium. And when you have atherosclerosis, basically there's dysfunctioning of that endothelium to allow for fat to like kind of get underneath and into that blood vessel. And so cinnamon seems to have some protective effects against endothelial dysfunction. There's also a lot of oxidative damage that's happening at the cellular level with atherosclerosis. And it seems cinnamon does have some effects against that oxidative stress. It reduces, again, high fats in the blood and inflammatory mediators. The other thing that's interesting with atherosclerosis development too is you actually get smooth muscle cells that sort of migrate and proliferate in that inner layer of a blood vessel that were like at a level that they're not supposed to be. So it's kind of this odd thing that happens. And it seems like cinnamon has the ability to sort of repress that proliferation of those vascular smooth muscle cells. And in studies in chickens, they do show that it does reduce oxidative stress, and again, has an effect at lowering cholesterol, specifically LDLs. Again, we don't know much about that well enough in parrots to say if that'd be a benefit or not, but it does reduce it in chickens and also triglycerides as well. We can go on to the next slide. Okay, cranberries. So people often, when they're learning about nutritional health for themselves, they may hear the word flavonoids, and flavonoids are just natural compounds that are in food items, like our fruits, our vegetables, teas. They're these natural compounds that act as anti-inflammatories and have antioxidant properties. And cranberries are one of the food items. There's many food items that actually are rich in flavonoids, but cranberries are one of those that are rich in flavonoids. And there's many different types of flavonoids. So like I mentioned before, there's not just one compound in a food item that may be helpful. There's multiple different compounds. And so sometimes it's difficult because we want to, as scientists, isolate this one very specific thing that is the beneficial thing. And sometimes it's a combination of things that's really beneficial. So I do have a list of the different types of flavonoids that may be beneficial. Again, in our other mammalian friends, these flavonoids have been shown to reduce oxidation and inhibit enzymes that are involved in the production of lipids. And in a mice model for atherosclerosis, where they gave them freeze-dried cranberries at different percentages of the diet for 8 weeks, they also fed them some fat because they were trying to give them a little extra fat to like try to induce some atherosclerosis development, but then also, hey, we're giving you some cranberries at the same time to see how that has any effect on prevention. And they found that those that received the cranberries in the diet had lower cholesterol levels compared to control. So something that may be beneficial as a preventative. You can go on to the next slide. When they look at it in chickens, it has been supplemented as like a pumice that's been added to the diet. And it actually will result in higher levels of linolenic acid. And remember, linolenic acid is an omega-3 fatty acid. So it actually will increase omega-3 fatty acids in them, and it lowers cholesterol again in them. And then there was another study that kind of repeated it, but in a slightly different way. And they found that, again, had lower levels of fats in these birds when given cranberry pumice compared to those that did not receive it. You can go on to the next slide. Okay, alfalfa. Now this one I think is a little interesting because I often do not think about alfalfa for birds. I think about alfalfa for more like herbivorous mammals. But alfalfa actually is, if you look at a couple of different brands of pellets, there are a couple different brands of pellets that do have alfalfa as like one of the ingredients in the diet. And interestingly, there is literature that supports that it may be helpful again on fats and maybe have some anti-atherosclerotic effects. In, again, more of our mammals, it has shown to lower cholesterol and lipoproteins in plasma, and it led to a reduction in aortic and coronary atherosclerosis. So that's kind of cool. Could it have that benefit in birds? There's a particular component in alfalfa. It's called saponins. So saponins are this like combination of like a carbohydrate and a fat, that what it's doing is it actually will like bind other fats and can bind other carbohydrates and kind of make this like foamy, soapy sort of thing, and like kind of sequesters fats essentially. And so it's thought that that's maybe how it has its benefit, is that those saponins in the alfalfa will maybe be able to bind up fats, make this sort of like foamy, soapy thing, and then help the body excrete it. In studies in rabbits, it's been shown that there's a reduction in hypercholesterolemia. But also at the same time, this particular study, it's interesting. We hear about these things and we're like, wow, could this potentially be beneficial? But in this particular study, it wasn't a reduction that was that significant. So like, cool that it reduces it, but maybe not that helpful. And we have to keep that in mind always with all these things that I'm talking about, because it may sound great initially when we're talking about it, but is it something that is really going to make a significant effect, an effect enough to where we're like, wow, we should really have this be a part of the diet? But there was on the flip side of that, when we looked at, or when the researchers looked particularly at certain levels in the blood vessels to see where cholesterol was developing, there was reduced cholesterol in different parts of blood vessels. So that was good because, again, in atherosclerosis, we're seeing these fat building up in the vessels. Okay, we can go on to the next slide, where we're able to talk about some research that was done in chicks. In chicks, when they fed alfalfa seed, so the seed part of the diet, to chicks, they did have lower levels of fats. They did see increases in HDL cholesterol, which in mammals is thought to be the good cholesterol. Again, we don't know enough about it in birds to make a across the board statement here, but maybe it's something that could be beneficial for those birds where HDL may be a healthy cholesterol. They also had lower levels of cholesterol within the liver and heart muscles. And then in another study that was done with broiler chickens, they, again, had decreases in their fat levels. They had decreases in antioxidant or reduction of oxidative damage. And there was also reduced expression of genes that are involved in fat production. So various levels on which it could be having its beneficial effects. Okay, next slide. Okay, so fenugreek, it's a spice. I don't know how many people have had this in their own diet or used it or anything like that, but I do actually have a client who uses it in her cockatiels, and she came to me and was already having this as a part of the diet and asked if it was a problem. And I was like, well, you know, I know a little bit of information on this in other species. Maybe it could be beneficial for them. I didn't tell her to stop doing it because her cockatiels both had high fat levels of high cholesterol and high triglycerides. And I thought, well, you know, maybe it is something that could potentially be helpful. But again, this fenugreek, this spice, is kind of similar to the alfalfa, where there's those saponins that help, or is believed to be the component of it that's helpful, that may be binding up those fats and helping to reduce these high levels of fats in the blood. There was a study, particularly in laying chickens, where they gave them fenugreek as 2% of the diet, and they found that there was a reduction in cholesterols, LDLs. And again, they had this increase in HDLs. What does that mean? Hard for us to say, but maybe it's beneficial for them. On the contrary, there was a different study with fenugreek in broiler chickens, and they found that it really didn't have any effect on their cholesterol levels. Now, they were doing it at different percentages in the diet. They were doing it for a shorter period of time. So this is where, when we look at different studies, we have to really pay attention to the details. And this is where, you know, the veterinarians, the scientists who are looking at these things and making recommendations for patients have to really look at the details that happen, because, okay, in this one study, there wasn't really much of an effect, but they only did it for 18 days versus this other study, they did it for 4 weeks. So like, maybe that's not going to have some benefit right away, but maybe after a prolonged use, it's going to have some benefit. We really have to pay attention to that sort of stuff as we do more and more of these studies. Next slide. So ginseng. It's a root. There's a picture of it there. It also has some saponins. In particular, it has one called ginsenosids. I guess I might be saying that wrong, but I think that's how you say that. And again, scientific studies are showing it lowers fat levels. It reduces apoptosis. Apoptosis is where cells are like just dying. It decreases vascular calcification, which is something we do see with atherosclerosis. It alters the expression of genes that are related to atherosclerosis and lipid production, and it also regulates inflammatory pathways. It has been tested in chickens, both laying hens and broilers. It's also been tested in quail. And again, it's been found to reduce fat levels in them. We'll go on to the next slide. There's just a few more things to mention, and then I'll be finishing up here. Red pepper is another one. I'll try to go quickly because I know we're coming close to the end. Again, red pepper is something that can be added to the diet. There's studies in mammals that show it helps reduce fat levels. It has a reduction in atherogenic index compared to controls when they've done studies in it. And there have been studies in chickens that, again, show it lowers fat levels in the blood. So maybe beneficial. We can go on to the next slide. Okay, these ones are interesting because these are flowers. And I don't know how much people think about adding flowers to the diet, but parrots do eat flowers. So it is something to consider. So two different ones to touch on, saffron, which if you look at this picture here, the saffron is the purple flower that's up at the upper left-hand corner. And the active component of it is those little red things that are coming off of the saffron flower. So like that's the active component that has been used in studies, and it's been shown that that reduces, acts as an antioxidant, reduces inflammation, and reduces fat levels. Now there's two components in there, something called crocin and crocin, and those are the compounds that are thought to be having the benefits at helping reduce fats and inflammation. And then gardenias, which are probably a flower that is more popularly known, they also have crocin, but it's actually in the fruit component of that. We can go to the next slide. There was a study that actually took those saffron petals, those little red parts, and they fed it to broiler chickens and found that it lowered their fat levels. And then a different study with crocin from the gardenia, they gave it to quail and found that it lowered fat levels. It also increased or maintained nitrous oxide levels in the serum, and nitrous oxide in the blood is supposed to be helpful, like vasodilating, so may have some benefits there. And then also it inhibited the thickening of certain layers of blood vessels and decreased the accumulation of certain inflammatory cells, those macrophages that are part of the foam cells we talked about earlier. It reduced those, so that's kind of cool. I've got one more slide. You can go to it. All right, last thing, turmeric. I think a lot of people have heard about this for various things, various reasons. The roots and rhizomes, they contain a bioactive chemical called curcumin. It does have some anti-atherosclerotic properties because it reduces inflammation, has some antioxidant effects, and inhibits the vascular smooth muscle cell proliferation that we had talked about that is part of the atherosclerosis pathophysiology. And studies in broiler chickens have been done with it and found that it showed reduction in fat levels. But then there's also other studies in chickens that have been done that showed really no changes in fat levels. So again, it's going back to the details and looking at the differences between the studies to see, well, where does it actually have benefits? What do we actually have to do to have that effect to make it be helpful for our birds? So you can go to the next slide. I think that's just just my conclusion slide, which just says that there's, lots of food items that have potential benefits at reducing the potential for atherosclerosis. We absolutely 100% need to be doing studies in citizen birds to see if they even help. This is just really for us to start thinking about and saying, could we potentially use these things to help prevent atherosclerosis? Because prevention is so much better than treating it. But we definitely need studies in birds.
Thank you so much. And I realize we ran over our plan time for the talk itself. We just had so many things that we wanted to talk to you guys about today. We had intended to leave a good block of time for questions, and I've kind of eaten up that time. I apologize. Also, I'm working at the hospital today, and I have an appointment waiting for me. So we might have to keep our Q&A a little bit short on this, but I know that it's possible for people to submit questions that then we can respond to written answers, things like that.
Yeah, Brenna, would it be easier if we just sent you and Dr. Lamb the questions and then we can send out on our end? And that way then if you needed to head to your appointment, you can head to that?
Yeah, I think that would work best. And
Okay.
I'm sorry to not be able to kind of do more Q&A in person today. The last thing I wanted to say is that so this picture is of a bird named Zuri, very near and dear to my heart, who passed away this year. But we caught her heart failure very early, and we were able to get her. She responded to treatment for almost 10 years. And which was really, kind of a record for us. And she was really a rock star and just a wonderful bird, and pay tribute to her. But also, I just want to say how much I appreciate Stephanie Lamb's input. It's just been incredible today, and how much I appreciate everybody tuning in and joining us today.
Yes, thank you, everyone. Oops. Give me 1 second, trying to pull up our screen. All right, so if anyone has any additional questions that they haven't put in the comment or in the Q&A, you're welcome to email me at the email that's listed on the screen, and I'll make sure Dr. Lamb and Dr. Fitzgerald both get these. But thank you both so much for your time and for the presentation. We're all very excited for it, and we will talk to you guys later. Bye, everybody.